ჩვენი შეხვედრის თემა არის კანაფზე დაფუძნებული მედიკამენტების გამოყენება. დილით გვქონდა უკვე შეხვედრა მედიკოსებთან, პროფესიონალებთან და გავიმსჯელეთ მათთან კლინიკურ მონაცემებზე, ეფექტებზე, გვერდ ეფექტებზე ამ მედიკამენტების ეხანდელი შეხვედრა არის ზოგადი პოპულაციისთვის, იმ ადამიანებისთვის, ვინც შეიძლება სხვადასხვა მიზეზის გამო დაინტერესებული იყოს ამ თემის და ეს მიზეზი ბევრი შეიძლება იყოს ხშირ შემთხვევაში და ესეთი ადამიანი და ოჯახი ბევრია საქართველოში, არიან ადამიანები, ვინც სხვადასხვა მდგომარეობის გამო იყენებს ამ პრეპარატებს, როგორც თვით მკურნალობას ჯერჯერობით საქართველოში, იმიტომ რომ ტრადიციულმა მკურნალობამ ვერ გამოიღო სასურველი შედეგი, სხვა მიზეზით შეიძლება არსებობდეს ინტერესი ამ თემის მიმართ. ჩვენ ვიცით, რომ დღეისათვის მზარდია მოცულობა მტკიცებულებებისა, კლინიკური მტკიცებულებებისა, რომელიც მეტყველებს, რომ ეს მედიკამენტები შესაძლოა ძალიან სასარგებლო იყოს სხვა სიმპტომების თუ დაავადებების მკურნალობის დროს. მზარდია იმ ქვეყნების რაოდენობა, სადაც გამოიყენება კანაფზე დაფუძნებული მედიკამენტები და ახლო მომავალში კიდევ უფრო მეტი მტკიცებულება და კიდევ უფრო მეტად მყარი მტკიცებულება გვექნება ამ პრეპარატების ეფექტებზე. 600-ზე მეტი კლინიკური კვლევა მიმდინარეობს ამ ეტაპზე, ერთ-ერთი წყაროს თუ დავეხნობით. მე მოხარული ვარ, ჩვენ გვაქვს დღეს შესაძლებლობა საერთაშორისო არენაზე ერთ-ერთ წამყვან სპეციალისტს შევხვდეთ, პროფესორი კირსტენ მიულერ-ვალი ჰანოვერის უნივერსიტეტიდან არის ჩვენთან ერთად იმისათვის, რომ გაგვიზიაროს ერთ-მხრივ თავისი გამოცდილება ამ პრეპარატების გამოყენების, მაგრამ არამხოლოდ აგრეთვე გააკეთოს მიმოხილვა დღეს არსებული მდგომარეობისა, თუ სად და როგორ და რა შემთხვევაში ხდება ამ პრეპარატების გამოყენება. პროფესორი მიულერი არის ჰანოვერის უნივერსიტეტის სამედიცინო სკოლის ფსიქიატრიის, სოციალური ფსიქიატრიის და ფსიქოთერაპიის პროფესორი. ასევე არის ნევროლოგიის და დასრულთა ფსიქიატრიის სპეციალისტი, ტურეტის სინდრომის ამბულატორული დეპარტამენტის ხელმძღვანელი ჰანოვერის უნივერსიტეტში. იგი არის ტურეტის სინდრომის შემსწავლელი ევროპული საზოგადოების პრეზიდენტი, ასევე არის კანაბინოიდური მედიკამენტების გერმანული და საერთაშორისო საზოგადოებების პრეზიდენტი. 2017 წელს მან მიიღო კანაბინოიდური მედიკამენტების საერთაშორისო საზოგადოების ჯილდო კლინიკურ კვლევებში განსაკუთრებული მოღვაწეობისთვის კანაფის და კანაბინოიდების როგორც მედიკამენტების ხელახალი დანერგვის შესახებ. პროფესორი მიულერ-ვალის გამოქვეყნებული აქვს 160-ზე მეტი სამედიცინო პუბლიკაცია. იგი არის რამდენიმე წიგნის თანაავტორი, მათ შორის პირველი ავტორი გერმანული სახელმძღვანელოსი ტურეტის სინდრომის შესახებ. იგი არის თანაავტორი ამ სფეროსთვის მნიშვნელოვანი წიგნისა, რომელიც შეეხება კანაფზე დაფუძნებულ მედიცინას. ჩვენი შეხვედრის ფორმატი ითვალისწინებს 2 საათს. პირველი საათი დაეთმობა მოხსენებას, რომელსაც პროფესორი მიულერ-ვალი გააკეთებს, შემდგომ ყველას დარბაზში დამსწრებს და ონლაინ მონაწილე ადამიანებს ექნებათ შესაძლებლობა დასვან კითხვები და მიიღონ მონაწილეობა დისკუსიაში. Kirsten, please, floor is yours.
Once again, thank you very much for this kind introduction. Thanks for having me. And in my second lecture today, I Once again, I want to give an overview about cannabis-based medicine, but I will focus on some different aspects, and therefore it's not only a repetition of what I've said today in the morning. And of course, I'm aware that this is a lecture for lay people, and therefore I really will try to explain it in lay language. So what I would like to do is to give you an overview about the historical aspects of cannabis. Then I will explain some words and terminology that we are using. So in other words, cannabis, what means what. Then I will mention those drugs that are currently used in medicine related to cannabis. I will give you some basic ideas about the endocannabinoid system. This is a system in our body, and when we talk about cannabis-based medicine, you have to know that this system is specifically targeted. So in other words, when we use cannabis-based medicine, these are not unspecific effects somewhere in the body, but we now know specifically where in the body these cannabinoids work and acts. And then I will give you a brief introduction into indications, side effects, and will finally mention some legal aspects related to this topic. So let's start with some historical aspects. And this goes not back hundreds, but indeed thousands of years. So in this landscape, it's nicely illustrated when we talk about the history of cannabis. This goes back thousands of years, and this is in all different countries and continents and in all different cultures where cannabis plays and played a role in the past. So it's not restricted to some specific areas, although cannabis was used and popular in different areas in the world in different centuries. So when we look into this in a little bit more detail, then, for example, the Greek physician Galen prescribed that cannabis can be used as a medicine, and this was already before Christ. So it goes back hundreds and thousands of years that it's already mentioned that cannabis might be a useful medication. And for example, and this is exactly what we are discussing today, for example, it's suggested that cannabis has some analgesic effects. And here, you cannot read it, but here it's mentioned that it can be used for treating pain. And here in China, it's mentioned in some older descriptions that cannabis might have some antibiotic or anti-emetic effects. And this is exactly the indications we are discussing today. So in Germany, in Middle Ages, there was a very famous nun. Her name is Hildegard von Bingen, and she was really an interesting female. She was very much interested in herbal medicine, and in one of her guides, she said, hemp can be used for a variety of treatments, such as healing wounds, reducing pain, including headaches. So in different cultures, and this goes back to the Middle Ages, we are discussing about different effects of cannabis-based medicine. Here you can see that even before the Christian era, mainly in Asia, cannabis was used as a medicine, and in Western European countries, the climax for cannabis-based medicine was reached in the last decade of the 19th century. Unfortunately, you cannot read what it's written here, but it says that this increase in Western European countries is closely related to an Irish physician. His name is William O'Shaughnessy, and he really described cannabis as a medicine, and he was a man who really brought up the idea in Western European countries that cannabis is a useful medication in different indications. This is a photo I took myself in a pharmacy in an old German hospital. This goes back to the 19th century, and there you can see that cannabis was a well-established medication in German pharmacies about 150 years or 200 years ago. So it was absolutely normal that you could receive a cannabis medication in forms of tinctures or oils in Western European pharmacies. This is a picture how it looked like at 1900 when you wanted to receive a cannabis-based medication. This is made by a German pharmaceutical company. The name is Merck, and this company still exists today. And this is a picture how it looked like from an American company, Park Davis, and this is again a cannabis medication. So after this, there was a decline of medicinal cannabis, and this was related to different reasons. So first, it was difficult to identify those substances that are in cannabis plants. And this was an interest at that time because, and this is absolutely correct, because we want to know what's in a medication when we use it for treatment. And this was impossible because the structure of cannabinoids is a little bit difficult. And in addition, in the cannabis plant, there are so many different ingredients, and therefore it was impossible 100 years ago to identify all these different compounds. And in addition, it was difficult to find exact dosages. So the dosages differed from treatment to treatment, and this is also not good when you try to treat a medical condition. And finally, in parallel, new chemical and synthetic and chemically well-characterized drugs were developed, and this all resulted in a decline of medical use of cannabis. But in parallel, there started cannabis prohibition, and this was not based on facts, but it was based, to be honest, on political reasons and partly even on racism. So in the US, in the beginning of the 20th century, Mexicans immigrated to the US, and they brought their tradition of smoking marijuana with them. And this resulted in reactions because at that time in the US, alcohol was the drug that was mainly used, and therefore many people disliked that people came into the US that used a different drug. And then this cannabis prohibition policy was related to this man. His name is Harry Anslinger, and he was the head of the Federal Bureau of Narcotics. And he decided to start a war against drugs, and in particular, a war against cannabis. He first decided to argue that cannabis is, although scientists said it's not that much dangerous, he claimed that cannabis is a very, very dangerous drug. And even more, he claimed that only people belonging to degenerated races use this dangerous drug. And even more, he said that marijuana may induce violence and cause insanity. And to top it even more, he said marijuana misleads white women having sex with black men. So it's really kind of racism that is related to this cannabis prohibition. And finally, all these arguments resulted in a Marijuana Tax Act and in law, the Controlled Substances Act, and the final end we all know, that was the complete ban of cannabis, not only for recreational use, but also for cannabis use. And for many, many years in most countries, cannabis was scheduled as a Schedule 1 drug, so this prohibits the use of cannabis for any purposes. This is the situation about 100 years ago, and this is not only based on scientific reasons, but also, and this we should have in mind, on these strongly political reasons. So there's a cannabis renaissance, and we see it in many countries today. And this renaissance is related to two important dates. The first one is related to this guy. His name is Raphael Mechoulam. He's a scientist from Israel. He's now more than 90 years old. He's a very, very smart guy. If you have the chance to listen to him, I strongly recommend this to you. And some people say he's the godfather of medicinal cannabis. So he's a chemist, and what he did, he identified the chemical structure of THC. THC stands for tetrahydrocannabinol, and this is the most important and most psychoactive ingredient of cannabis. And at that point, it became clear that it's possible to identify the ingredients of cannabis. I told you that this was a problem some years before, and he was the first who were able to identify one of the most important ingredients. The second most important step in the renaissance of cannabis happened in 1988. So at that time, the first component of the endocannabinoid system in our body was detected. And again, this guy, Raphael Mechoulam, was involved in this research, and they described the CB1 receptor in our body, mainly located in our brain. And from this time on, it became clear, when using cannabinoids like THC, that they act directly and very specifically at a receptor system in our brain. And with this detection, a huge research interest started to investigate first, what is the reason that we have an endocannabinoid system in our brain? So what is this system physiological do with us, and wherefore it is important? And second, we became interested in what happens when we stimulate this system. So in other words, you can stimulate this, but also you can block it. And this is what we normally do with medications. We stimulate or block specific systems in our body, and therefore we became interested in to do this also with this newly developed endocannabinoid system. So to give you some information about the terminology we use when we talk about cannabis-based medicine. So first, cannabis is not like cannabis. So cannabis is a plant, and we know that there are different strains, and we have a botanical classification for these different strains. And depending on the form of the leaves, we classify cannabis into cannabis sativa, cannabis indica, and cannabis ruderalis. But there are some experts that argue that this is not the correct classification, but all these different strains belong to one so-called mother strain. And there's still an ongoing discussion whether this kind of classification is really the final and the best classification for cannabis strains. When you use cannabis, we are talking about the medicinal use of cannabis. There are several other uses for cannabis. It can be used as a plant material, so for example for textile fabrics, and you also can use it for food and cosmetics. So the medicinal use of cannabis is only one part of the whole story of the cannabis plant. I already mentioned in the beginning that there are so many different ingredients in the cannabis plant, and currently we know about more than 500 different ingredients. And once again, you understand why it was impossible 100 years ago to identify all these different ingredients. Only one part of them are so-called cannabinoids. It's about 100 different cannabinoids that are in this cannabis plant. And there are two cannabinoids that are currently most important and most well characterized. This is this compound, THC, tetrahydrocannabinol. There are different forms, delta 9 and delta 8. And the second most important is this one. It's called cannabidiol or CBD. But there are other cannabinoids in the plant, and currently it's not absolutely clear whether they can be used for therapeutic reasons or not. And in addition, in this huge amount of different compounds, we have some groups. They are called flavonoids or terpenes. And in addition, it is discussed whether these ingredients also contribute to therapeutic effects of cannabis. And by the way, these terpenes are those ingredients that are responsible for the typical smell of cannabis. So these are not the cannabinoids, but it's related to the terpenes. There's one discussion about the combination of these different cannabinoids, terpenes, and all the other ingredients in cannabis that is called entourage effect. So this means that we discuss that the combination of these different hundreds of different ingredients is an advantage and not a disadvantage in the cannabis drug. And the idea behind this so-called entourage effect is that this combination of all these different ingredients increases the efficacy of THC and reduces the side effects of THC. But this is still an ongoing discussion. There are some people who prefer using pure THC when they use cannabis-based medicine, and others prefer the whole ingredients of the plant because they argue that this entourage effect improves the effect and reduces the side effects. For those of you who are more chemically interested, these are the structural formulas of cannabinoids. And you see that these are lipid formulations because of this ring structure. And here again, you see all these different, in part, cannabinoids in the cannabis plant. So I mentioned already that cannabis can be used for different purposes, not only for medicine, but also as hemp to produce textile or something like this. And you decide on what to do with your cannabis plant depending on the cannabinoids. So in other words, when the THC content is high, you prefer to use the cannabis plant as a medication. And in most countries, it's allowed to use cannabis plants without or with only a very low content of THC for many other purposes. And in many countries, it's allowed to grow cannabis only when the THC content is near 0 or below 0.3 or 0.2. This is a little bit different from country to country. So when we now focus a little bit more on cannabis-based medicine, this is a list about the drugs that are currently available, not only in Germany, but all over the world. And to give you an idea what's behind these different names, I will try to classify these different substances. So first, there are substances that contain only pure THC. And these drugs are named THC or tetrahydrocannabinol or dronabinol. This is all the same. And there's one synthetic drug that is more or less the same than THC. It's called nabilon. So these drugs contain only THC, nothing else. And then we have drugs that contain only CBD. And this is a complete different story, although they are both part of the cannabis plant, and I will tell you the difference in a moment. And most drugs that are currently used worldwide contain both of these cannabinoids, THC plus CBD, and this is first a cannabis extract that is named Sativex. It's a finished medicinal product, and in many countries it's officially licensed, for example, for the treatment of spasticity and multiple sclerosis, or for the treatment of neuropathic pain. But there are also other cannabis extracts, and of course there are cannabis flowers that in some countries are allowed to be used for medicinal use. All these extracts and all these flowers are standardized for their content of THC and CBD. So this is clear in every drug, but all other ingredients are not declared. So even for me as a medical doctor, it's unclear what about the content of other cannabinoids or other ingredients. And this is because it's difficult to declare all ingredients. And in addition, we believe currently that these are the two most important ingredients in extracts and flowers, and therefore the content of THC and CBD is declared. And another way how to classify all these different substances is that we have only very few drugs that are officially licensed and that are finished medicinal products. So in most European countries, it's Cannabis, this THC drug, Sativex, this cannabis extract, and Epidiolex, this pure CBD drug. In the US, there are two further THC drugs officially licensed. In the majority of the cannabis drugs and all cannabis flowers and the majority of the cannabis extracts are prescription drugs. So in other words, these drugs are not finished medicinal products. They are not produced by a pharmaceutical company. They are not officially licensed for the use in medicine, but they have to be prepared in pharmacies for individual use in individual patients. And as you can see here, when you look at the numbers in Germany, we now have more than 70 different cannabis extracts and more than 100 different strains that are available in pharmacies and can be prescribed by medical doctors. These are the drugs. I will go through this quickly, but then you can see and have an idea what's behind these different drugs. These drugs are drugs that contain only pure THC. They are mostly used as oral medications and mostly as capsules or as oily drops. And then you can titrate them and specifically define the dosage, how many milligram THC or how many drops per day the patient should take. In addition, we have this pure CBD drugs. I mentioned this finished medicinal product Epidiolex. It's licensed for rare forms of epilepsy. And in addition, we have this prescription drug. And again, for this prescription drugs, it's the medical doctor who decides to which patient, for which indication, in which doses this shall be used. This is the cannabis extract nabiximols. It's a finished medicinal product. As mentioned before, it's licensed for the treatment of spasticity and multiple sclerosis, and this happened in Germany 11 years ago, in 2011. It's a sublingual spray, as illustrated here, so the intake as well is orally. I've mentioned it after the cannabis law came into force in 2017, the market exploded in Germany, and another huge number of cannabis extracts came on the market. This was the first one by a Canadian company. The name is Tilray, and this was a really good strategy that they decided to come on the market with the cannabis extract. Because until today, this is the cannabis extract that is most often prescribed in Germany. So it was a really good idea to start with this from the economical perspective. Today we have a long list of different cannabis extracts. This is only the first side of 3, so it's more than 70 different extracts. And all these extracts are standardized for the content of THC and CBD. And what you can see here the ratio is 1:1 or 10:10. So it's a balanced product. And we have also products with more CBD or products with more THC. And this is the most important information you have to take from this picture. And then we are allowed, since 2017, to prescribe cannabis flowers, and this is how it looks like. This is, for example, from a Dutch company. The name is Betrocan, and they were the company that first imported cannabis for medicinal use to Germany, and in the very first beginning we had only their cannabis flowers, and again the THC and CBD content varied, and we had to decide which flower to choose when we wanted to prescribe it for medicinal purposes. And then we can decide as medical doctors whether the whole cannabis flower, as illustrated here, is prescribed. When you decide for this way, the patient must be able to grind it before he or she can use it for inhalation, using a vaporizer or smoking it. And you also can decide, and you have to write it here on the prescription, you can decide that this grinding is made by the pharmacist. There are some explanations for pharmacists how to prepare cannabis flowers for inhalation. This was in 2017, so only few cannabis flowers with different contents of THC and CBD. And as mentioned before, the market exploded. And this is the situation of today. It's only one page out of 6 pages. And I've mentioned in the beginning, we have more than 100 different cannabis strains. You see a lot of companies that are active in the market, and there's a lot of competition in this market because you can earn some money here in this market. And there's some discussion about whether at least some of these companies only wait for legalization of cannabis for recreational use, because then you need cannabis flowers, and when you are already on the market, on the medicinal market, some people argue that then it will be easier to be also part of the recreational market. But this is only a speculation. Similar to the cannabis extracts, all these cannabis flowers are standardized for THC and CBD content, and again the classification is balanced products, THC dominant and CBD dominant cannabis flowers. And this is an older figure just to illustrate this. In green, it's the THC content, and in red, it's the CBD content. And currently, we have more THC-dominant flowers on the market. And the highest content of THC in cannabis flowers in pharmacies is 25%. And the lowest one is 1%. When we recommend and prescribe cannabis flowers for inhalation, then we recommend to use a vaporizer. And the reason for this is very simple, because in a vaporizer, cannabis flowers are not burned, but only heated. And this makes a huge difference. When you smoke a cigarette or smoke a joint, then the flowers are burned, and this burned plant material you inhale, in addition to the cannabinoid that you want to inhale. And inhaling burned plant material is never something that is healthy for you. And therefore, we recommend to use a vaporizer where the cannabinoids are only heated. There's some development in parallel. These are the vaporizers that are currently used. But there's some development for new devices, and when you compare this is not on the market yet, but it's under development from an Israeli company, and when you compare this with that, it makes a huge difference, and this is much smarter, looks much more like a medical device, and there are a lot of companies who invest money in this development, and besides the optic, there is also a huge difference, because in these vaporizers, there are filling chambers. And when you want to use this vaporizer, you have to fill it by yourself. So you must be able to do this manually, and people who are severely ill might not be able to handle these devices. And therefore, companies started to develop vaporizers that have pre-filled cartridges where grinding and self-filling is no longer needed. And another idea behind these devices is that they can be programmed. So me as a medical doctor, I can program this, and the patient is able to use specifically that amount that is programmed by me, and therefore I can avoid that the patient use higher dosages. So there's a lot of effort and development with respect to these devices. Why is it important to heat cannabis flowers before you should inhale it? So the reason is that in your cannabis plant, there's an inactive form of THC. So in other words, when you go to someone who grows cannabis, ask him to give some cannabis to use and to you, and then you start to eat it, nothing at all will happen. You can eat it and waste your money this way, but nothing will happen. And the reason is, in the cannabis plant, there THC is in an inactive form. It's an acid, THCA, and by heating the cannabis plant, THC acid is decarboxylated, and this results in the active form of THC, and this is exactly what you are doing when smoking cannabis or when using a vaporizer. And here it's illustrated that the temperature must be relatively high, and normally we recommend for vaporization a temperature of about 180 at minimum, better 200 degrees, so that this is really effective. When the temperature is lower, you must heat the cannabis flower longer. So for example, you can put your cannabis flowers in the oven, and then you must heat it, let's say, by 150 degrees, but it takes longer than when you have higher temperatures. I already mentioned this entourage effect, and once again, this is something that people speculate that this is an advantage of using cannabis flowers and cannabis extracts, and this relates not only to the different cannabinoids but also to the terpenes and the flavonoids. But once again, this is a hypothesis, and it's not absolutely clear whether this is really true. And some people argue that it's much better to use the pure THC or pure CBD treatment. We talked about route of intake, and I mentioned several times that flowers are mainly inhaled, and extracts and THC are mainly orally taken. And this is a huge difference. It's not better to inhale or better to take it orally, but it's simply a difference. And this is important for medical treatment. So the most important differences relate to the onset, relate to the peak concentration, and relate to the duration of the effect. So in other words, when you decide for an inhalation, the onset is very fast. Within a few minutes, most patients report that the effect is immediately starting while inhaling. But on the contrary, the effect does not last that long, so on average 2 or 3 to 4 hours, while when you take cannabis orally, then the effect lasts much longer. Some people decide, doctors and patients decide to combine these different ways of administration. So they use an oral medication for, let's say, like a retard medication, so that you have a level of cannabinoids in your blood and in your body all over the day. And when you then have some acute peaks of your symptoms like pain, tics, or whatever, then in addition you can use these immediate effects of inhaled cannabinoids. So this is also possible. So I already mentioned this endocannabinoid system in the body, and I would like to give you some information about this because it's important to understand how cannabis-based medicine works. And I already mentioned that in 1988, the first part of this endocannabinoid system, this CB1 receptor, was detected. Today we know that there is not only one receptor, this CB1, there's also a CB2 receptor, but there are also other receptors in our body, and researchers believe that there are undetected further receptors in this complex system in our body. As can be seen here, these endocannabinoid receptors are located in all different organs and systems all over the body, and they are densely located in the brain. To go into more detail, we have not only these cannabinoid receptors, but we also have endogenous ligands. So these ligands bind to the cannabinoid receptors, and it's similar to other transmitter systems in our body. So for example, the dopaminergic system. Dopamine binds to dopamine receptors, and by this, the dopamine system is activated and can work in our body. And the same happens in this endocannabinoid system. So these endocannabinoids, and the two most well-known are anandamide and 2-AG, they bind to these cannabinoid receptors and by this activate or stimulate this system. CB1 receptors are mainly located in the brain, but today it's clear that they are also outside the brain, and vice versa. CB2 receptors are mainly located in the peripheral, but also in our brain, and once again there are other receptors that have been detected in recent years. When we use THC, then it's like a key use that THC binds to these CB1 or CB2 receptors. So in other words, what our body does physiologically, endocannabinoids bind to receptors and stimulate the system, you can do by using THC. So by using THC, and this is today absolutely clear, you stimulate your system similar to what your body is doing when producing these endocannabinoids. With CBD, the story is much more difficult and completely different from this stimulation via THC at these CB1 receptors. And as illustrated here, CBD works as an antagonist, and this means CBD blocks cannabinoid receptors. So it's just the opposite. THC stimulates it, and CBD blocks these receptors. And this is what I've mentioned in the beginning. CBD is not the little brother of THC. These are two completely different compounds. And I talked about this entourage effect, that it might be a good idea to combine these different compounds. And now you know and understand why. Because you stimulate cannabinoid receptors by using THC, and you block them a little bit by adding CBD. And this, from the clinical perspective, might make sense by reducing side effects caused by THC. This is the idea behind. Today, much is known about this endocannabinoid system. Hundreds of researchers are interested in this system, and there are today pharmaceutical companies who started to develop new drugs that do similar things like cannabis, THC, cannabis flowers, but they act differently because they interact with this complex endocannabinoid system. So in parallel to our discussion using cannabis, cannabis flowers, THC for medicine, the pharmaceutical industry started to develop chemical drugs that interfere with these compounds in the endocannabinoid system. And depending on the development in the next few years, it might happen that in the future we will have licensed drugs interfering with the endocannabinoid system. And I have a little bit the fear that when these drugs are really on the market, and these are drugs that must go through this process of license. So the companies must deliver large, well-designed studies before these drugs are allowed to be prescribed and sold on the market. It may happen that then cannabis flowers go in the background, because for these drugs currently we do not have this kind of studies. So it's an interesting development, but this makes clear that this system is very, very much in focus from different perspectives. So for what indications do we currently use cannabis-based medicine? I already mentioned that it's absolutely clear that this endocannabinoid system is very important for our well-being. And it's not only important for cognition, for behavior, for all different things that are illustrated here in different organs and in different systems. So it's really a system that is distributed all over our body. And this suggests that diseases in all these different systems might be targeted by cannabis-based medicine. So I already mentioned that we have some products that are officially licensed. This is cannabis for use of multiple sclerosis, spasticity, cannabis for nausea and vomiting and chemotherapy, and this compound Epidiolex, this CBD compound, for the treatment of some rare epilepsies. So in other words, these indications are really well established: spasticity, nausea, and these specific forms of epilepsy. In addition, in some other countries, this is the situation here in Germany, and in some other countries, cannabis-based medicine is licensed in addition for AIDS wasting syndrome and for some forms of pain related to the neurological system and related to tumor. And therefore, I would like to conclude that all these indications are well established, and there is more or less no discussion about whether cannabis is effective, yes or no, because we have drugs that are officially licensed for these indications. In addition, cannabinoids are well established in palliative care. So palliative care means that you treat patients at the end of their life. These patients are severely ill, and we have good data to believe that in these patients, cannabinoids can be used to improve quality of life, to reduce pain, to increase appetite, to reduce anxiety, to improve sleep, to improve mood, all aspects that may be helpful for patients in palliative care. Our main problem currently is that we have huge difficulties to increase our knowledge about efficacy in cannabis-based treatment, because although we have a lot of publications, most of these have no data included. So most of these publications we see currently that are published are reviews. They only summarize and repeat already available data. But what we need are clinical trials presenting new data. And this is really a disaster, and this is something we really wait for these trials, and they are not initiated because it's very expensive. And because the cannabis industry, the pharmaceutical companies who produce cannabis, are not so much interested in performing and initiating these clinical trials because of the high costs. And in addition, because cannabis flowers cannot patent it. So besides these well-established indications, we have data that tell us that a lot of people use cannabis for other indications. And this is real-world data. This comes from a survey published in 2013. More than 900 patients participated, and they informed the researchers that there's a huge spectrum of different diseases why they use cannabis, and different diseases from all different subjects in medicine where they find cannabinoids are helpful. And in red now, these are diseases belonging to the spectrum of psychiatry. So in other words, we know from surveys like this that a lot of people with psychiatric disorders use cannabis and tell their doctors that this is helpful. This is another survey. It was performed in Germany. I was involved in it. And it was an online survey, and we asked specifically patients who used cannabis flowers prescribed by a physician. So it was not a self-treatment, but it was prescribed by a physician. And we wanted to know, why are you using cannabis flowers? And again, a huge spectrum of diseases was mentioned. And when you again look how many of these diseases belong to the spectrum of psychiatry, it's a huge number. And when zooming in, then you see a lot of patients suffering from ADHD. PTSD means post-traumatic stress disorder, depression, sleeping problems, tic disorders, anxiety disorders, use cannabis, and the doctor, otherwise it wouldn't be prescribed, and the patients feel that this is a helpful medication. And I would like to focus on two indications to make clear to you how controversial this discussion is. So the first indication is ADHD. Not only in Germany, but worldwide, we know that a lot of patients suffering from ADHD self-medicate, some of them even self-grow cannabis and use it for the treatment of ADHD. But currently, German guidelines for the treatment of ADHD says do not use cannabis because the database is weak. So this is the problem currently. Patients tell us it's effective. Guidelines tell us, guidelines are based on evidence. Guidelines tell us don't use it. And this is the situation we are struggling with. Similar, the situation in post-traumatic stress disorder, and this is nicely expressed by the title of this editorial. Here the author is asking a potential efficacious intervention for PTSD or simply snake oil. So this is the situation for many of these indications we are discussing, that the database is so weak that we really cannot decide whether this is an effective treatment, yes or no. Another interesting indication is related to opioid use or to addiction, because there's some discussion that cannabis can be used as a substitute to treat patients suffering from opioid addiction. So this is my personal summary. It's not an official statement, but it's my personal summary in which indications cannabinoids are effective. And I made some lists so to give you an impression what my idea is. And first you have to decide and differentiate between THC and CBD dominant products. When we first look at THC containing cannabinoids, then I would say efficacy is approved for chronic neuropathic pain, for chronic tumor pain, for other forms of chronic pain, for spasticity and multiple sclerosis, for nausea and vomiting after chemotherapy, for AIDS wasting syndrome, and for palliative care. Then I have an addition list. I called it probable efficacy. And there I would include other forms of pain, such as migraine. Remember, we have heard it from Hildegard from Bingen. She also suggested that cannabinoids might be effective in headache. So migraine might be another indication, cluster headache, and other forms of pain. Spasticity and other neurological diseases might be good indication, then Tourette syndrome and other chronic tic disorders, ADHD, and in addition another relatively rare but very severe psychiatric disorder called autism spectrum disorder. Another indication from internal medicine might be irritable bowel syndrome, and from the neurological spectrum, restless leg syndrome. And then I made a third table, talking about THC-containing cannabinoids. And here you find a long list of other indications where we have some weak evidence from case series, open, uncontrolled, small studies, or even only single case reports that cannabinoids might be effective. And for example, I have one patient who suffered from treatment-resistant epilepsy. He is a man in his mid-30s, and he had a severe car accident when he was a young man. He had a head trauma, and thereafter he developed an epilepsy because of this head trauma. He went to a university clinic in Germany, and they tried all epileptic drugs that are on the market for this kind of epilepsy, and in the end they concluded he is a patient suffering from treatment-resistant epilepsy. And this patient didn't want to accept this. And then he read somewhere that cannabis might be helpful. Until this date, he never used cannabis for any reason. And then he decided to travel to the Netherlands, buy some cannabis, and from that day on until today, he's using it and never ever had any epileptic seizure once again. So this is now 5 years ago that he started to use cannabis. Now I'm the treating physician. I prescribe cannabis flowers, and he's again able to drive a car, because when you have a long time without any epileptic seizure, you can reapply for your driver license, and now he's allowed to drive a car. Another example, I have some patients suffering from severe stuttering. So stuttering is really a disabling condition, because most of these patients who stutter severely, they are not able to give presentations like me. And in addition, it's not a huge problem if you don't want to give oral presentations, but your communication with other people at work, at your social life, is strongly influenced by stuttering. Most of these patients develop, in addition, social anxiety disorder, and most of these patients are depressed. And this patient told me that when using cannabis, his speech fluency is significantly improved. And therefore, we decided to apply for reimbursement at his health insurances. And in addition, because I found this so interesting, I asked my colleagues from the department who cares for these patients, because I'm not an expert in stuttering, of course. And what we did is we made some specific speech fluency tests before and after treatment with cannabis flowers, and there was a significant improvement. And these are single case reports, so it's absolutely clear that this is not robust evidence, but in these single cases we saw a significant improvement that results in a significant improvement in patients' quality of life. So, and then I have a shorter list for pure CBD products. As mentioned in the beginning, these CBD products are officially licensed for these rare epilepsy forms, so I would say efficacy is approved. But there are other possible indications for CBD products, and here in my list I included autism spectrum disorder, I included psychosis, I included anxiety and possibly pain, but the data we currently have tell us clear that THC has much stronger effects on pain compared to CBD, but there's some evidence that even pure CBD might be effective in some forms of pain. One warning: when you go to a shop where CBD is sold, please be aware that these freely available CBD products are not intended for medicinal use. So in Germany, we also have a market where you can buy all these CBD products, but these are either cosmetics or food additives. So these products are not on the market for medicinal treatment, although companies often promise that they may help for all these different conditions. But this is not evidence-based, and this is only, let's call it a kind of a marketing strategy. And when you buy a bottle like this, and use some drops, you are far away from dosages we are discussing here when we talk about CBD as a medication. So if you want to, you can use it. It's for your well-being, but please be aware that this is not for medicinal use. This figure should give you an idea why cannabinoids might be effective in so many different conditions. And the first idea why this is true is related to the fact that the endocannabinoid system in our body is very important for modulating all other transmitter systems in our body. As you will know, we have a lot of transmitter systems in our body, and specifically in our brain. There's serotonin, there's dopamine, there's glutamate, there's GABA, and all these different transmitter systems are modulated by your endocannabinoid system. The second aspect is that the most important stress regulatory system in your body is this endocannabinoid system. And this makes sense because a lot of those conditions I mentioned in my presentation are deteriorated by stress. So in other words, when you use a compound that reduces your stress level, it's absolutely clear that symptoms related to these conditions improve in parallel. And finally, there's some discussion about deficiency or dysfunction in this endocannabinoid system. We know neurological disorders, for example, where we have a clear idea where in the brain and where in the body the cause of this disorder is located. For example, you suffer from Parkinson's disease. Then we know that you have a problem in your dopaminergic system and your brain does not produce enough dopamine so that you can walk and behave and move smoothly. And you can speculate that there might be some well-known and well-described disorders that are related to a dysfunction in this endocannabinoid system. Currently, this has not been proven, but from my perspective, it's absolutely clear that there will be some conditions that are primarily caused by a dysfunction in this system. There's an ongoing interesting discussion about whether cannabinoids might have some neuroprotective effects. What does this mean? So we have conditions or disorders that we call neurodegenerative disorders. So the most prominent is dementia, Alzheimer dementia. And there's some evidence that cannabinoids might influence several of those processes that are that contribute to this neurodegeneration. So in other words, there's an intensive discussion whether cannabinoids have some neuroprotective effects. And this is important for several very severe diseases where we currently have no cure at all. So for example, AD stands for Alzheimer's disease, PD stands for Parkinson's disease, HD for Huntington's disease, and ALS for amyotrophic lateral sclerosis. These are very severe neurological diseases, and the idea is to use cannabinoids in the very first beginning of these neurodegenerative disorders to stop the progression of these conditions. So when we use medications, we also have to talk about side effects, and the most important aspect when we talk about side effects that cannabinoids cause relatively often side effects, but these side effects are mainly transient, occur early in the treatment, and are mainly mild. The most often side effects you see are dizziness, somnolence, vertigo, and dry mouth. And what is illustrated in this figure is that when you start low and go slow, and this is exactly what is recommended for treatment using cannabinoids, and this is seen in these red bars, then the number of side effects is lower compared to initiating with a higher dose and up-titrate faster. And therefore, a standard slogan in the treatment using cannabinoids is start low and go slow. There are other side effects. For example, you can read it in the product information of this licensed product Sativex, but most of these side effects does not play a significant role when you follow this slogan, start low and go slow. So in other words, cannabinoids are extremely safe, and compared to other drugs we normally use, they cause less side effects and less severe side effects. So I would like to finish with some legal aspects. You may know that there are some countries in the world that are traditional producers of cannabis. This is not in Europe because of our bad weather, but there are some countries where you can grow cannabis in outdoor growing facilities, and this is in different parts of the world as illustrated here. And this is our current situation with respect to cannabis. And you see that in different countries in the world, we have different rules with respect to medicinal use and with respect to recreational use. And even if medicinal use is allowed, different countries decided for different laws and different rules. And there was a huge change in last years, and more countries decide for legalization of medicinal use, and in addition, some countries already decided for legalization of recreational use, or at least for decriminalization. So what is our situation in Germany? I already mentioned that in 2017, the cannabis law came into force in Germany. And this changed our situation dramatically, because from this day on, in March 2017, we were allowed to prescribe cannabis flowers and cannabis extracts made from these flowers. This was really a change in cannabis medicine. In addition, we have a second law, and there it is defined when health insurances must reimburse the costs for cannabis-based treatment. And there are three aspects that are defined. So first, the patient must suffer from a severe illness. Second, there must be no generally accepted standard therapy, or if this does exist, it cannot be used in this specific case. And finally, there must be a reasonable possibility that the medical cannabis will have a positive effect on the disease process or on serious symptoms. And if these three aspects are fulfilled, according to our law, health insurances must reimburse the cost for cannabis flowers, for cannabis extracts, or for THC, and the decision what shall be used is made by the treating physician. Currently in Germany, we have 3 companies that are allowed to grow cannabis. This was a development in parallel to the legalization of medicinal use. The idea behind was that we become independent from the import from the Netherlands, from Canada and other countries. But today it's absolutely clear that these 3 companies and the number of, or the gram or kilogram of cannabis they are allowed to grow and to sell is strictly limited. And today it's absolutely clear that this is not enough, and we have to see whether this will change in the near future. Self-cultivation is still not allowed in Germany. This is something our last government, but also the current government, does not want to see, and therefore it's prohibited. This is the development in Germany after the cannabis law came into force, and you see that there was a huge increase in prescription rates for medicinal cannabis. So in other words, we really use it. It's not only theoretically that you can use cannabis, but doctors do it and patients want this kind of treatment. Here you have an impression how the rates are related to the different products. And interestingly, in pink, these are cannabis flowers. And this is the medication, the cannabis-based medication, that is most often prescribed in Germany, followed by cannabis extracts. And interestingly, in gray, the number of those finished medicinal products that are prescribed is relatively low. So this might be an argument for this entourage effect, that cannabis extract and cannabis flowers with all the different ingredients might be more effective and better tolerated compared to these medicinal, finished medicinal products. And here you can see what our health insurances do. Although I explained that there's a relatively clear law when when health insurances must reimburse the costs, in reality the situation is a little bit different. So about 1/3 of applications are rejected. In the beginning we were told, okay, the doctors made some mistakes, they submitted applications that were incomplete, they ignored the rules that are written in this law. But I would say in 5 years medical doctors learned how to do this, but the rejection rate did not change. Until today, about 65% are accepted, but about 1/3 is still rejected. And this is a huge problem we are faced in Germany. And the applications that are most often rejected come from patients suffering from psychiatric indications. And this is really a huge problem because I tried to explain to you that there is a huge group of patients who use cannabis, and we as psychiatrists are not able to prescribe it, at least when we want that health insurances cover the costs. And there are some experts, and among me, who fear that this procedure in the end will result that people accept cannabis as a pain medication. And this is the most often indication where cannabis is prescribed for, and that they will try to accept and pay the cost for cannabis as a pain medication, and will try to explain to the government that for all other indications it's not efficacious. So this is really a problem, and we are just thinking about what we can do, because when health insurances refuse to cover the costs, medical doctors cannot use it in most cases, although patients can pay for the medication privately, but the costs are relatively high. And when physicians do not do this, they cannot practice it, they cannot learn, and this may result that in the end, because we have no studies, medical doctors are not doing it, and this seems to be a strategy health insurances follow in our country. There are other problems with our cannabis law, although it was a huge step forward. Besides this relatively high rejection rate, we have other problems currently. So overall, it's estimated that only 0.1% of insured people receive cannabis-based medicine. In other countries, the rate is much higher. So we still assume that cannabis-based treatment can and should be used more often, and that there are more patients who could benefit from cannabis-based medicine, at least when we compare data in the US, in Canada, or in Israel, because the percentage of patients who receive cannabis-based medicine is much higher. The health insurances argue that the costs are too high. So they tell us we have to pay millions of euros for cannabis-based medicine, mainly for flowers, but for all other preparations as well. And they argue they have to reduce these costs because it's a kind of an explosion. But you also can argue, and there's some data, by using cannabis-based medicine, you save other costs, you save other treatments, and when you improve patients' condition and when you improve patients' quality of life, then it might help to reduce indirect costs because patients go back to work. And this is something that has to be realized and has to be recognized as well. Currently, we are discussing to legalize recreational use in Germany too. And we all expect that this will happen in about 2 years in 2022. But I strongly suggest when you in your country discuss about legalization of cannabis, not to mix these two different aspects. Medicinal use is completely different from recreational use, although it's an important discussion and it should be discussed in each single country. In addition, and I've mentioned this, we have some market for food edibles. So this is related to pure CBD products. But in the EU, we have a law that is called Novel Food Catalogue. And in this Novel Food EU Catalogue, it's regulated that pure CBD was not on the market before this catalogue became into force. And therefore, in all European countries, it's now forbidden to sell pure CBD as a food additive. And all the companies who did so decided to sell their products as cosmetics. This is legal. And for example, you can find some oily liquids, and there it's suggested to take it in your mouth and thereafter to spit it out and not to swallow it, because cosmetics shouldn't be swallowed. But this is a niche where companies try to sell their CBD products because they are no longer allowed to sell them as food additives. This is an attractive market for companies, so it shouldn't be ignored. A lot of companies earn a lot of money with these pure CBD products that are not for medicinal use on the market. And therefore, I think each country have to find ways how to regulate this and what they would like to see on their market. And for example, in Germany, it's strictly forbidden to advertise these CBD products as cosmetics for medicinal use. This is completely forbidden because, as I've mentioned before, these are not medicinal drugs. So my final remarks are, when you discuss about legalization, differentiate the discussion about recreational use and medicinal use. Today it's absolutely clear that cannabis is a potent drug, although it may be misused by some people. It seems that different from other drugs, cannabis is a powerful drug in improving a wide spectrum of different symptoms and conditions. Cannabis is very safe and very well tolerated, although there are some side effects that shouldn't be ignored. But when you compare cannabis to well-established other treatments, it really is a well-tolerated and safe drug, and this is true not only for pure THC but also for cannabis flowers, and the risk for addiction is relatively low. My final remark is with respect to medicinal cannabis. We urgently need new, large, well-designed studies to increase our knowledge, and only when we have robust knowledge we can really say in which indications cannabis is preferable compared to standard medication that is already available. Thank you for your attention.